One. Okay, so I am going to be doing a full assessment on a new patient, and I am going to gather my supplies for that. And I'll need a notepad. All right. Knock, knock.
Hello.
Hi, my name is Lindy. I'm going to be your student nurse.
Hi.
Just going to move this for safety. Hand sanitize. Make sure her bed is locked. Provide privacy. Okay. Could you verify your name and date of birth for me?
Yeah, it's Brandy Giovanni, 12/30/1990.
Okay, and Mrs. Givetti, do you have any allergies?
No.
Okay, awesome. So, I am here to be doing a full head to toe assessment on you just to make sure that we get a clear baseline of your entire health condition.
Okay.
Is that going to be okay?
Yes.
All right. So to get started, I'm just going to ask you a few questions and do vitals, and then we'll do the rest.
Okay.
Okay. Do you have any cultural preferences or religious beliefs that will affect our care today?
No.
Okay. And can you tell me a little bit about your home situation, who you live with, and those sorts of things?
Yeah. I live out in the country. I live with my boyfriend and kids. It's comfortable, safe.
Okay. All right. And do you work at all?
I go to school full time.
And how is school going for you?
It's good, tiring.
Yeah,
Yeah.
I can imagine that.
Mm-hmm.
Do you have any other stressors or feel anxiety, depression, anything like that?
No.
Okay. Have you ever had any suicidal ideations or mental health issues?
No.
Okay. And then can you tell me, you've told me your name and date of birth. Can you tell me where we are right now?
Yeah, Casper College.
Okay, and what is the date?
It is April 25th, 2025.
All right, and who's the President of the United States?
Donald Trump.
Okay, all right, so I just note that she is alert and oriented, ×4. She doesn't have any cultural or religious beliefs, and when I walked in, I was just assessing her overall appearance. I was noting if I smelled any strong odors, noticing if she was clean, dressed appropriately, any kind of first impression that I can see walking in. When she was talking to me, I noticed that her speech was clear, her verbiage was appropriate, and her mood and facial expressions didn't show any signs of pain. I noticed that she wasn't labored breathing, no tripoding, and she didn't seem to be in any sort of distress. Okay, so I am just gonna start with your vitals now.
Okay.
Okay. Also, before I start, do you have any pain right now? 0 being none and 10 being the worst pain?
0.
Okay. So I'm gonna clean off my supplies. Make sure everything's good. Clean this off. All right. So we'll just start with the pulse ox and temperature. And we'll check your temperature. 98.8. And her oxygen is 98, pulse is 77. All right, you can remove this, and then I'm just gonna feel your radial pulse. Okay, I got a pulse of 70 and a respiration rate of 15. Okay. So I'm gonna just start from your head and move all the way down, if that's okay with you.
Okay.
Okay. So I'm gonna lower your head a little bit. And actually, I did forget to do your blood pressure, so I'm gonna do that first, if that's okay with you.
Yeah.
Okay.
I'm always curious.
Do you have any issues with blood pressure?
No, it's usually low, but not too low.
Okay. Have you noticed, like, when you stand up, do you get dizzy, or have you ever had any fainting spells or anything like that?
No.
Okay. Alright. Oh, your pin line's coming out. I'm just gonna set that there for you. Maybe.
That's why it's always dead.
Okay, so I felt for her brachial pulse. Make sure that the arteries lined up. Alright, that was a little low. I got 98 over 58. Is that pretty average for you?
Yeah.
Okay. Sorry.
It's alright.
Okay, so now I'm gonna have you just sit on the side of the bed once I get you lowered in the same position.
Okay.
Okay. And then I will just start from the top down.
Okay.
Okay, so I am gonna be looking at her hair and overall appearance, making sure that her hair is evenly distributed, her face is looking symmetrical. I don't see anything that's really standing out as abnormal, no lesions, bruising, cuts, anything. Then I'm gonna be looking for infestations, any dander, cleanliness. I'm feeling for any indentations or swelling. Do you feel any pain when I'm palpating?
No.
Okay, and do you have any headaches or migraines?
No.
Okay. Any head trauma in the past?
No.
Okay. Okay, and then I'm gonna feel the frontal sinuses. Is this tender? Okay. And her nasal sinuses?
No.
Okay, and her skin is feeling warm. It's even color and complexion. I'm gonna look at her ears for any discharge, skin breakdown, anything that looks abnormal. And how's your hearing?
Pretty good.
Have you ever had to have hearing aids or surgeries for your ears?
No.
Okay. Then I'm gonna look at her eyes, making sure that there's no drainage, that they're able to focus on me. There's no strabismus or nystagmus, and I don't see any discoloration of the sclera. Okay, I'm gonna grab my pen light. Okay, I'll just have you look at me. Okay, so pupils are equal, round, reactive to light, and let's check your accommodation. If you could look at me and then look out the window. Okay, so our eyes are accommodating. All right, I'll have you look up so I can look in your nose. I would check for any deviated septum, any lesions or blood, anything like that. Do you have any difficulty breathing through your nose?
No.
Any sinus issues, pain?
No.
Okay, and then I would note that her lips are moist, they're not dry, no cracking, sores, and you could open. Okay, I would check her teeth, seeing if she has dentures, any fake teeth, making sure there's no breakages or sores in her mouth. Check her uvula, make sure that it's midline, noting any redness, swelling, and that looks normal. Okay, so then I'm gonna just palpate her neck, checking lymph nodes, any masses. Okay, feel her trachea, make sure that it's midline, there's no deviation, and I'll have you just look a little to the left, feeling her jugular vein, making sure there's no distension. I would note any scars, moles, anything, and I'll have you look this way. Okay, everything's looking good there, and her face and skin were all warm and appropriate for ethnicity. Let's see. So, talking about your face and stuff, do you have frequent colds, nasal congestion,
No.
any difficulty chewing, swallowing?
No.
Okay. Have you ever had any frequent episodes of strep throat or anything like that?
No.
Okay. And with your vision, do you see an eye doctor?
Yes.
Okay. And do you have contacts or glasses?
Yes.
Okay.
Contacts.
Okay. And do you do okay with them? You don't have any problems?
No.
Okay. Just make sure that you're continuing to see them on a regular scheduled basis.
Okay.
Okay. So next I'm gonna move down to your chest, and then we'll do your extremities and abdomen.
Okay.
Okay. So I would start by inspecting, making sure that her skin is clear, it's warm, I don't see any lesions, any skin breakdown, no bed sores, making sure I don't see any abnormal lumps, no barrel chest or pigeon chested. She's looking symmetrical. I see even chest rise and fall. I'm gonna have you bend forward just a little bit. I would make sure that her spine is in a straight line. Check for any surgical scars. Palpate, are you feeling any pain?
No.
Okay. Okay, check for any abnormalities, noting any scars, like I said. Okay, and then again, I looked at her chest, so now I'm gonna listen to your lung sounds and heart sounds.
Okay.
Okay. Okay, so if you could just take a deep breath.
Okay. Okay.
Sorry about that.
I left my phone on loud.
Okay, we'll just start back with the respirations. I'm gonna listen to 6 points on the front and back. Okay, so I'd note that her lungs were clear and equal bilateral. I didn't note any crackling, any bronchostridor, anything like that. Do you have any history of pneumonia, bronchitis?
No.
Chest pain, short of breath?
No.
Okay, do you use an inhaler for exercise or anything?
No.
Okay, all right, so I'm gonna listen to her heart sounds now. I'm gonna start with the aortic, then her pulmonary, Erb's point, tricuspid, and mitral. Okay, so I'm gonna note regular rate and rhythm, that I noted S2 and S1, no murmur. Everything sounded appropriate. So I'm gonna listen to your apical pulse for 1 full minute, if that's okay.
Okay.
All right. All right. So everything sounded good. Again, I would just note that I listened to S1, S2, regular rate and rhythm, and I didn't notice any murmurs again. Okay, so now I'm gonna start from your shoulders and down your extremities.
Okay.
Okay, so I'm gonna feel the bones, her muscles, make sure that her muscle tone is appropriate and equal on both sides. Noting any joint swelling or arthritis. I don't see any edema. I'm gonna feel her radial pulses. They're both equal, strong, and in sync. Okay, her skin is warm and dry. I'm gonna note her fingernails are don't have any clubbing or yellowing. They look short and clean. And check her capillary refill, which was less than 3 seconds. Okay, I'll have you go like this. I'm gonna note any scars, swelling, redness. Do you have any swelling in your hands or anything?
Nope.
Okay, we'll check a little bit of range of motion.
Okay.
So I'm gonna start with your head, and I'll just have you tilt it like this.
Okay.
And then forward and back. Okay, now we'll do shoulders. I'll just have you raise them. Okay. And then go up. And back down. Down. Sorry. And then flip your wrist. Okay, do this and this. All right, good. Okay, I'll have you pull. Okay, and then push. All right, and then squeeze my hands. Okay, so strength is equal on both sides, and her range of motion was good. Okay, so have you had any numbness, tingling, any sort of things in your extremities?
No.
Okay, have you noticed any cold hands, any problems with any movements?
No.
Okay, can you also do this? Okay, just to check her fine motor skills. And then I'm gonna check your sensations.
Okay.
I'll just have you close your eyes, and when I touch you, let me know if it's a sharp sensation or a dull sensation.
Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull.
Okay, good. So her sensations are intact. I will just have you lay back down, and then I will check your stomach.
Okay.
Alright, so for this, I will need my stethoscope. I'm gonna raise you back up a little bit.
Nice.
And then I can lay you back down. Do you mind if I lift your shirt up a little bit?
Nope, go ahead.
Okay. So I'm gonna lift her shirt up. Before I start, I'm just gonna inspect, noting any distension. Make sure that I don't see any big masses or hernias. Noting her scars. She has 5 scars across her midsection. What were your scars from?
Hysterectomy.
Okay, and do you still have your gallbladder?
Yes.
What about your appendix?
Yes.
Okay. So that looks okay. Her skin is even. So I'm gonna listen to the 4 quadrants now. Okay, so her bowels were active in all 4 quadrants. I'm just gonna palpate a little bit now. Can you tell me about your bowel movements? When was the last time you had one?
Yesterday?
Okay, and was it normal consistency, color?
Yeah.
And are you pretty regular?
Yeah.
Okay. Have you had any problems, hemorrhoids, pain?
No.
Okay. And I'm gonna note that her stomach is soft, it's not distended. Besides the scars, I'm not noting any moles or masses, lesions, skin breakdown, anything like that. Okay, so I'm gonna put this back down. All right, so I'm gonna do your lower extremities now.
Okay.
Okay, I'm gonna move to the other side of the bed. Bring this. Okay, so I would start by the hips, feeling the bones, checking her muscles, making sure that her muscle tone is equal on both sides, noting any lumps, checking her skin temperature, and yep, her skin temperature is warm and her skin is dry. Feeling her knees. Do you have any knee pain?
Nope.
No? Have you ever had any lower extremity injuries or surgeries?
No.
Okay, I don't know any swelling or abnormalities in her knees. Do you mind if I lift up your pants?
No.
Okay, going down. Just making sure that everything's equal. I'm gonna feel her posterior tibial pulses. Maybe. And they are bilateral and strong and in sync. Okay, I'm gonna remove your socks if that's okay. Okay, again, I'm just inspecting, noting that her toes are clean cut, there's no discoloration, I don't see any sores from her shoes, no redness or swelling. I'm gonna feel her for her pedal pulses. Wow, your pedal pulses are strong.
Really?
So they are strong, equal, bilateral. Making sure at each section that I'm also checking hair distribution, making sure that it's equal. I'm not seeing any patchiness. And on her ankles and feet, I'm checking for any edema. Do you ever get swollen feet or any pain or numbness?
No.
Okay. Do you have any problems with your shoes fitting?
No.
Okay. Before I put these on, I'm gonna check your sensation.
Okay.
So again, I'll have you close your eyes and let me know if it's sharp or dull. 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 Sorry, let me try that again with the lead out. Okay.
Oh, sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp.
Okay, good. So her sensations are intact and she's feeling adequate. Okay, put your socks on and you can pull these down. All right, for the range of motion for your legs, I will just have you lift this leg, put your knee up,
Okay.
okay, and then just spread it to the side to check your hip, okay, back and down, and then the same with this one. Okay, so she does have knee flexion and extension as well as hip flexion extension. Then I'll just have you lift your feet towards you and then down, okay, and then I'll have you push and pull. All right, so she also has equal strength in both feet. Okay, so I'm gonna have you just walk from this cabinet around to the end of the bed, if that's gonna be okay.
Okay.
Okay, so I'm gonna lower her for safety. Okay. And I'm just gonna assess.
Okay.
Okay, so when she's walking, I'm checking her posture, noting any lordosis or kyphosis, making sure that she's not favoring either side, no limping. Have you ever used any assistive devices?
No.
Okay, and have you had any injuries or problems with your walking or gait before?
No.
Okay. All right, so it seems like the assessment is going pretty well. I'm just gonna have to do the GU now. So I will have to have you get into a hospital gown, and then I will check that if that's okay.
Okay.
Okay, so we're gonna move to the mannequin. Okay. So I am gonna get on gloves for this. What time am I at?
26.
Okay. All right, so I am gonna raise the bed. My patient's now in the hospital gown, so I can get a better view of the perineum. All right, and before I get started, can you tell me a little bit, do you have regular menstrual cycles?
Yes.
Okay, any heavy bleeding, excessive pain, anything like that?
No.
All right, and are you on any birth control?
No.
Okay. Have you had any issues with bladder infections, itching, burning?
No.
Okay. And for your breast, do you do at-home self-breast exams?
Yeah.
Yeah, have you noticed any bumps, any nipple discharge, rippling, tenderness?
No.
Okay, and that's just an important thing for you to continue doing and make sure that you report any changes that you notice in your breast.
Okay.
Okay, I'm gonna lift your hospital gown if that's okay.
Okay.
Okay, so when I do this, I can get a better skin assessment, making sure that I'm noting distribution of hair is appropriate, noticing any foul odors, any discharge, any swelling, tenderness, lesions, any breakdown. I could palpate the bladder. Is this tender?
No.
Okay. Make sure that everything is in alignment and I don't see any injuries. Is it okay if I flip you over to look at your back?
Nope, that's fine.
Okay. Okay. I'm gonna do this. Roll you over just a little bit, okay? So I'm gonna look at the lower back down to the coccyx, making sure that the end of the spine isn't showing for spina bifida or anything like that. Check the anus for any discharge, any more injuries, skin breakdown, bed sores, anything like that. And everything's looking normal. Check for hemorrhoids, and make sure that the skin is warm and intact, also dry and clean. And then I could also be checking for any parasites or infestations in any of the hair or body parts I'm seeing. Okay. And I think that's all for my GU assessment. Again, have you noticed any urinary burning, itching, UTIs frequently?
Nope.
Any signs of STDs or have been STD tested?
Nope. I'm okay.
Okay.
Yep.
All right. Well, I'm gonna cover you back up then.
Okay.
Okay. Remove my gloves, perform hand hygiene, lower the patient's bed, make sure that the bed's locked, remove privacy. I'm gonna make sure she has her call light as well as her personal belongings. All right. Well, if you have any issues, please let us know.
Okay.
Thank you.
Thank you.